Type 2 diabetes occurs when the body does not make enough insulin. Insulin helps your body turn food into a form of energy called glucose. Without insulin, glucose from the food you eat cannot enter the cells. In type 2 diabetes, insulin is still present, but the cells are resistant to it. Your cells are starved for energy since they are unable to use the glucose that builds up the blood. If not treated well, this condition can cause damage to the heart, kidneys, eyes, nerves, and other body parts. Blood glucose is sometimes called blood sugar.
What causes diabetes? A number of lifestyle factors are known to contribute to the development of type 2 diabetes. Excess weight, defined as body mass index (BMI) of 25 or more, leading an inactive lifestyle, having abnormal cholesterol and blood lipids. High blood pressure and smoking are all factors that increase the risk of developing type 2 diabetes.
What are the initial symptoms? About 1 out of 3 people with type 2 diabetes don't know they have it and therefore are not even receiving treatment. One of the first symptoms of type 2 diabetes may be an increase in thirst. This is often accompanied by additional symptoms such as dry mouth, increased appetite, frequent urination, and unusual weight loss or gain. Additional symptoms may include headaches, blurred vision, fatigue, and troubling infections such as cuts and sores that are slow to heal, or frequent yeast infections.
Complications. Long-term complications of diabetes develop gradually. The longer you have diabetes and the less controlled your blood sugar is, the higher risk of complications. Eventually, diabetes complications may be disabling or even life-threatening. Possible complications include
cardiovascular disease. Diabetes increases the risk of various cardiovascular problems, include coronary artery disease with chest pain, angina, heart attack, stroke, narrowing of arteries, atherosclerosis. If you have diabetes, you are more likely to have heart disease or stroke.
Nerve damage, neuropathy. Excess sugar can injure the walls of the tiny blood vessels, capillaries that nourish your nerves, especially in the legs. This can cause tingling, numbness, burning, or pain that usually begins at the tips of the toes or fingers and gradually spreads upward. If left untreated, you could lose all senses or feeling in the affected limbs. Damage to the nerves related to digestion can cause problems as nausea, vomiting, diarrhea, or constipation. For men, it may lead to erectile dysfunction.
Kidney damage, nephropathy. The kidneys contain millions of tiny blood vessels clusters called glomeruli that filter waste from your blood. Diabetes can damage this delicate filtering system. Severe damage can lead to kidney failure or irreversible end-stage kidney disease, which may require dialysis or kidney transplant. The rates of serious kidney disease have dropped significantly in recent years, likely due to improvement in diabetes management.
Eye damage, retinopathy. Diabetes can damage the blood vessels of the retina, diabetic retinopathy, potentially leading to blindness. Diabetes also increases the risk of other serious vision conditions, such as cataracts and glaucoma.
Foot damage, nerve damage in the feet or poor blood flow to the feet increase the risk of various complications. If left untreated, cuts and blisters can become serious infection. Severe damage might require toe, feet, or even leg amputation.
Skin and mouth conditions. Diabetes may leave you more susceptible to skin problems, including bacterial and fungal infections. Gum infections also may be a concern, especially if you have a history of a poor dental hygiene. Osteoporosis. Diabetes may lead to lower than normal bone mineral density, increasing your risk of osteoporosis.
Alzheimer's disease. Type 2 diabetes may increase the risk of Alzheimer's disease. The poorer your blood sugar is controlled, the greater risk to appear. One theory is that cardiovascular problems caused by diabetes could be contribute to dementia by blocking blood flow to the brain or causing strokes. Other possibilities are that too much insulin in the blood leads to brain-damaging inflammation, or lack of insulin in the brain deprives brain cells of glucose.
People with diabetes have a higher risk of some cancers, but the reasons aren't clear. It may be that the factors that increase the risk of type 2 diabetes also increase the risk of cancer, or it may be a factor of the disease or its treatment. This is an active area of research, but in the meantime, no changes in treatment are recommended.
Management. Diabetes management consists of controlling your blood glucose level with diet, exercise, and medicines. Take these steps if you have type 2 diabetes. What you will need: blood glucose meter, also known as glucometer, blood glucose test strips, glucose tablets, sugar pills, or glucagon injection to treat low blood glucose, hypoglycemia. Glucagon is a natural hormone that helps raise blood glucose in your body during fasting.
You might need to take insulin daily. If you do, you and your doctor will decide the best way to take it. Some things you might need are insulin, devices to deliver your insulin, example, needle and syringes, insulin pen and needles, insulin pump and insertion sets, alcohol swabs.
Steps to take: home care. You may need to check your blood glucose with a glucose meter. Your doctor, diabetic educator, or pharmacist will teach you how to use it. Here are general guidelines for your levels. Before meal or fasting blood glucose level in the average of 70 to 130 mg per deciliter. After meal blood glucose level must be under 180 mg per deciliter.
Hyperglycemia. You may not feel different when your blood glucose level is only moderately above this range. This is why you may need to regularly check your blood glucose levels. If it rises well above this range, however, you may experience symptoms of hyperglycemia. The symptoms may include more frequent urination, increased thirst and appetite, fatigue, blurry vision, numbness in feet. If these symptoms occur, check your blood glucose level and call your doctor or diabetes counselor.
Hypoglycemia. It is not uncommon for people with diabetes to experience hypoglycemia, particularly when starting or adjusting to new medicine. It is important that you know the symptoms of low blood glucose. Some symptoms include shakiness, anxiety, hunger, increased heart rate, sweating, feeling faint, and headache. If you experience symptoms, follow the 15-15 rule.
The 15-15 rule is: eat 15 grams of carbohydrate. This can be 4 ounces, 118 milliliters fruit or juice, regular soda, 2 tablespoons raisins, 4 or 5 saltine crackers, 4 teaspoons sugar, 1 tablespoon honey or corn syrup. Wait 15 minutes. Check your blood glucose level again. If it's still low, eat another 15 grams of carbohydrates.
Your doctor may give you a prescription for glucagon injection. If you cannot raise your blood glucose, you may need this injection. It is given like insulin. Diet. Following a healthy diet is very important. You will need to evenly spread out the number of calories you eat and drink during the day. Your doctor may guide you to work with a dietitian. A dietitian can help you plan meals and snacks. Eat a balanced diet. Ask your doctor or dietitian about the exchange diet and the carbohydrate counting. Stay away from the refined food like white sugar, white flour, and white rice. These have a lot of sugar or fructose. Eat your meals and snacks at the same time every day. For snack, try nuts or peanut butter. They have been shown to reduce risks of cardiovascular disease in women with diabetes. Eat regularly, don't skip meals. Eat foods that are low in saturated fat and trans fat and high in fiber. Eat more fish, chicken, and soy protein. Limit the amount you drink. Keep a food diary and share it with a doctor or dietitian. As your weight changes or you become more active, talk to your doctor about diet and medicines. Your doctor may need to change your medicines and dosage as you lose weight.
Physical activity. Exercise lowers your blood glucose levels. Regular exercise, for example 30 to 60 minutes of walking every day, can help keep your blood glucose in better control. Exercise increases the insulin sensitivity and helps you lose weight. It can help also your overall health to talk to your doctor before you start an exercise program. Try to include both aerobic exercise and strength training in your exercise routine. Wear comfortable, supportive, and protective footwear. Monitor your blood glucose levels more often if you are exercising a lot, and be sure to check your levels before exercising. Drink plenty of fluids before and during exercise. To treat low blood glucose, be sure you have sugar pills or another source of sugar like fruit juice when exercising. Avoid exercising too intensively. If you have symptoms of blood glucose, Stop exercising and take sugar pills or fruit juice right away.
Medications. Some people can control their type 2 diabetes with diet and exercise alone. Others need medicine. Your doctor may prescribe medicine that insulin secretagogues, sulfonylureas. Sulfonylureas derived from sulfonic acid and urea were initially developed in the 1950s and have remained a cornerstone of therapy for type 2 diabetes. They are frequently classified as either first generation or second generation agents. First generation sulfonylureas, acetohexamide, chloropropamide, tolazimide, and tolbutamide. More recently, second generation sulfonylureas include glyburide, were introduced and are now widely used.
The meglutinides are non-sulfonylurea, insulin secretagogues characterized by a very rapid onset and abbreviated duration of action. Ripaglinide pyrimidine is a benzoic acid derivative introduced in 1998, was the first member of the meglutinides class. The natoglinide Starlex is a derivative of amino acid diphenylalaniline and was introduced in the market in 2001. Biguanide. Metformin dimethyl biguanide glucophage is a synthetic analog of the natural product guanidine, whose history as a treatment for diabetes can be traced medieval times. It exerts its effect mainly by decreasing gluconeogenesis and by increasing peripheral utilization of glucose, indicated for type 2 diabetes mellitus who fail to respond to life modification as a single agent or in combination with other drugs classes such as sulfonylurea.
Improvement of insulin sensitivity. Thiazolidinediones, pioglitazone, and rosiglitazone are members of the thiazolidinediones class of insulin sensitizing compounds, originally discovered and characterized for their glucose and lipid lowering activity. Drug can be used alone or in combination with metformin or with a sulfonylurea. The primary effects of pioglitazone and rosiglitazone are the reduction of insulin resistance and improvement of insulin sensitivity, resulting in a reduction of fasting plasma glucose, insulin, and free fatty acids. Blocking the enzymatic degradation of complex carbohydrates in the small intestine, alpha-glucosidase inhibitors. Acarbose and meglitol are members of the alpha-glucosidase inhibitor class of oral anti-hyperglycemic compounds that function by blocking the enzymatic degradation of complex carbohydrates in the small intestine. These compounds lower postprandial glucose and improve glycemic control without increasing the risk for weight gain or hypoglycemia. Alpha-glucosidase inhibitors are competitive, reversible inhibitors of pancreatic alpha amylase and membrane-bound intestinal alpha-glucosidase hydrolase enzymes.
Incretin mimetics. Exenatide. Exenatide is a synthetic exenidine-based glucagon-like peptide 1 analog, a regulator of glucose metabolism and insulin secretion. Exenatide enhances glucose-dependent insulin secretion by the pancreatic beta cell, suppresses inappropriately elevated glucagon secretion, and slows gastric emptying. There was no increase in the risk of hypoglycemia when exenatide was administered in combination with metformin, most likely due to the glucose-dependent actions of exenatide. Liraglutide, with a mechanism similar to the exenatide, it is administered via a pre-filled subcutaneous injection device at a dose of 0.6 mg, 1.2 mg, or 1.8 mg, independently of meals. Current approved indications are as an adjunct to diet and exercise.
Dipeptidyl peptidase 4, sitagliptin as a generic name. Dipeptidyl peptidase IV inhibitors are compounds that increase the concentration of endogenous incretins, including glucagon-like peptide 1, by limiting the proteolytic cleavage by DDB IV.
You might need insulin shots, and the type and amount you need depends on your blood glucose levels and the progression of your diabetes type of insulin. Insulin include rapid-acting insulin, intermediate-acting insulin, and the long-acting insulin. For the rapid-acting insulin, there is insulin lispro, Humalog, and insulin aspart, Novolog, and for the intermediate acting insulins, there's NPH, which stands for neutral protamine hagidorn. Long acting, there is insulin glargine, Lantus, and insulin detemir, Livamer.
Storage. All insulins have an expiration date which is labeled directly on the product applies when they are unopened and refrigerated. Unopened insulin should be stored in the refrigerator at 2 Celsius or -8 Celsius. Insulin should never be frozen or stored in an ambient temperature greater than 30 Celsius. An insulin vial in use may be kept at a room temperature below 86 Fahrenheit or 36 Celsius for 28 days or about 1 month.
Your doctor may also give you high blood pressure drugs like angiotensin converting enzyme inhibitors, diuretics, cholesterol lowering drugs like statins. Low dose aspirin to prevent blood clots may be also prescribed. Take your medicines as directed. Don't change the amount or schedule. Do not stop taking them without talking to your doctor. Don't share them. Know what the results and the side effects may be. Report them to your doctor. Some drugs can be dangerous when they are mixed. Talk to a doctor or a pharmacist if you are taking more than one drug. This including over-the-counter O.T.C medicines and the herb or dietary supplements. Plan ahead for refills so you do not run out.
Prevention, lifestyle change. Controlling diabetes is most all about maintaining a healthy lifestyle. You and your doctor will plan change that help you to recover. If you are overweight, lose weight, then maintain a healthy weight. Understand how stress can affect your blood glucose. Cold, the flu, emotional stress can increase your blood glucose. Wear a medical alert bracelet or necklace. Take care of your feet. Keep them clean and dry. This prevents foot ulcer. Always wear socks, slippers or shoes. If you smoke, quit smoking. Carry extra sugar pills with you all the time. Talk to your doctor about vaccination to protect against pneumonia and the flu.
Prevention. Keeping your blood glucose under control will help prevent serious problems in the future. The best way to accomplish this is to follow these simple steps. Create a diet and exercise plan that fits into your schedule and stick to it. If needed, make minor changes to your plan if you are stressed, ill, or have increased your physical activity. Monitor and record your blood glucose levels as advised by your doctor or diabetes counselor. Take all your medicines as directed and be prepared if you experience hypoglycemia. Follow up with your doctor and other specialists regularly.
Follow-up. Have lab tests done regularly such as hemoglobin A1C. Measures your average blood glucose level over the last 2-3 months. Kidney function test and urine analysis to check for signs of kidney disease. Meet with dietitian. Have your eyes examined at least annually to check for signs of diabetic retinopathy. Have your feet examined at least annually to check for diabetic neuropathy. Have your heart and nervous system checked regularly for heart disease caused by your diabetes.
Call your doctor if any of the following occurs. Diabetes can lead to many complications. Call your doctor if you have any of these symptoms. Blurred vision or flashing lights, frequent infections, wounds that don't heal, chest pain or angina, legs pain or cramps when walking, impotency, tingling or numbness in hands or feet, recurrent vaginal infection, buildup of fluid or swelling in the legs, pain, burning or tingling sensation in the extremities, change of the color, odor or temperature in feet.